Welcome and thank you for joining us on this new episode of Mofeed-19. I am Hesham Sallam. I am joined today by my co-host Amr Hamzawy. This episode discusses an exciting new project based out of the American University in Cairo, Social Protection Egypt. To learn more about this project, its principal investigators and its project researchers, please visit socialprotectionegypt.com. Today, we are joined by the project's principal investigator, Dina Makram-Ebeid, who is also an assistant professor at the Department of Sociology, Egyptology, and Anthropology at the American University in Cairo. She is also joined by Amr Adly, a co-principal investigator on this project and an assistant professor of political science at the AUC. Amr and Dina, welcome. Thank you for joining us.
Thanks for having us.
Thanks, Hesham.
Dina and Amr, could you tell us a little bit more about the project and its motivations?
I'll jump in and maybe we can complement each other. So I think the idea came basically at the beginning of the COVID moment when we're in lockdown. And it seemed like specifically in Egypt, we had no idea what exactly was going on in terms of numbers, what's the situation. There was already a bit of talk about some form of aid being distributed to workers who work in irregular and precarious jobs. And so I think our impetus came from a sense of, okay, we need to understand what is going on. How specifically people who are the most marginalized have been affected by COVID. What are the kind of interventions that can happen? And that coincided with a call at the American University in Cairo to produce research that was pertinent to the socio-economic effects of COVID-19. And so we thought together of putting something that would help us researchers basically provide some empirical evidence in terms of the impact of COVID on the most marginalized people and what would be the forms of interventions needed.
Yeah, the point was also to contextualize the impact of the pandemic and the measures that were taken and that could have been taken like socially and related to the institutional and policy situation that was already there in Egypt. And that's why I think that the stress on precarious employment, on social protection programs was actually an excellent analytical link between the pandemic as a contingency and the like longer standing structural and institutional conditions.
In one of the project papers, specifically the one co-authored by Hiba Khalil and Karim Mujahid, you suggest that we need to move beyond the binary of formal and informal labor in analyzing the impact of the pandemic on Egyptian labor. What alternative approaches does the project adopt?
I think basically what we were struggling with was this idea that, precarious workers are only the ones who are, in the disorganized, if you want to call it like this, informal disorganized sector. And, those who have formal employment haven't been necessarily impacted as much. And I think increasingly what we see in formal forms of employment is, again, also precarity in its variety. And so I think our approach was, okay, of course, we need to understand, because again, it's starting from this idea that the main focus was necessarily on people who don't have contracts or who were given the government aid, which is, the 600 pounds and so on. But the idea then became, is this the only sector we want to be looking at? And is this the only place that's been affected, or has it been affecting also even more formally employed sectors, but in ways that are related to forms of employment security? What are the contracts? What are the kind of, for example, health coverage and social care coverage and so on that affects people who are employed? And that's why we introduced, not only through the labor angle, looking at the actual forms of employment relations and so on, but looking at what is the possibilities for healthcare for people even who are in the formal sector but still cannot really access proper healthcare if they're not, they don't have medical insurance and so on. So that was the idea, that it's not just one sector and we're forgetting whatever is happening, the incipient precarity that is happening to the formal sector as well, which is very well documented in numbers.
I agree with what you were saying, and let me just add exactly what Dina was saying. that we in the design of the project, we tried to introduce like a gender angle, together with the more traditional approach that focuses on employment conditions, like the distinction between those working in the informal sector or those working informally, regardless of the sector in which they are working. But of course, with like while being conscious of the gender dynamics that are there, especially with the overrepresentation of women in the informal labor market, and the over-representation of women in the different forms of precarious employment, not only in Egypt, not only in the global south, but in the world more generally. This is a statistical fact, and that's why we have one of the papers, and I think one that contributes significantly to the debate on on the question of precariousness in times of the pandemic, is the one on domestic violence, which transcends pretty much, by definition, the gender approach tries to transcend the dichotomy between the private and the public, and hence it's not just about the marketplace dynamics or about public policies that have to do with women's access to public services or to labor opportunities or to income in times of recession, but also it addresses the impact that the pandemic had on women in the so-called private sphere, which is as impacted, or was as impacted by the pandemic, as well as by the public policies or the lack thereof during these times. So I think that that this paper was quite a contribution, because it tried to bring in the discussion again about the institutional and policy frameworks that are already at work or that were already at work in Egypt by the time the pandemic hit, and at the same time how this impacted the position of women, especially the ones that happen to occupy the most precarious social as well as economic positions. So again, I think that this was quite complementary to the discussion of precariousness, but from a gender angle.
Thank you so much, Dina and Amr. In the paper that Hesham just cited, one of the major highly publicized government interventions to alleviate the impact of the pandemic on Egypt's informal labor has been the £500 stipend given to participants in the informal sector in Egypt. How does the project assess the effectiveness of the £500 stipend?
So I can I can start. So this is something that cuts across, especially on the both the background paper that tried to frame the overall project, as well as in the paper that addressed specifically social protection policies. Of course, we had to depend pretty much, especially quantitatively, on already existing official data. And this is lacking to a great extent when it comes to the exact patterns of disbursement of this emergency form of income. We do have, nevertheless, both quantitatively as well as qualitatively, based on anecdotal evidence, that there was this consistent discrimination against women. So most of the informal workers that had access to that income were males. And of course, this had to do with elements of the within the design itself of the policy, as well as the implementation, that of course could not treat many of the societal biases. So it's not that the state here was positive in discriminating against women, but it was the other way around, is that you don't have the policies were gender neutral at a time when precariousness is quite feminized. So that is one problem. However, there was also another finding that there was an overall problem with coverage the kind of data that is available, that is, or that has been accumulated in the past several years with the restructuring of subsidization and social protection in Egypt, away from universal subsidies to more targeted cash-based transfers. And the point is that the coverage is not as extensive. Many of these programs, by the way, are still being the database is still being built. Many of the capacities, the kind of intelligence, and this is something that with a balanced analysis was taken into consideration. It's not that these are fully fledged, well-developed programs. The problem is that the pandemic hit at a time when these programs were being designed, when there was an overall restructuring of the role of the state vis-a-vis society, like having to do with the redefinition of what social protection is, who should be the beneficiaries, etc. So this overall compromised the ability to reach out to some of the most precarious people, both quantitatively as well as qualitatively. The kind of help that could be or could have been extended to them, as well as the amount of help that was given to the biggest amount of people that were in need. So this is part of the finding. But again, like I think that the analysis was quite balanced, especially that part of the bigger team, and the team was quite big, were people that were insiders to a great extent to the design of many of these social protection programs. So they were aware of many of the limitations, so that eventually we could manage our expectations when it came to assessing the kind of performance that they gave. So maybe Dina has something.
Dina?
No, I mean, I totally agree with everything Amr is saying. I think one of the main things exactly is he's saying is the gender element of this stipend, but also these access and reaching people. And I think one of the things that will come out as recommendations in the policy papers is a unification of the registries that we have, where we know what, I mean, these registries exist already, but what we need to have is a form of a unification of, so that it's not every time we're reinventing the wheel in terms of go register, who are you, best have you registered or have you not? There are already existing databases that could have been used and have not been used to make this stipend more, to have more outreach. And I guess this is one of the things we recommend or those who wrote the papers actually basically recommend in the policy papers.
Are there any government interventions which, according to your research and the project, have been effective in alleviating the economic impact of the pandemic?
No, not that we know of. And I think that one of this is not exceptional to Egypt, especially bearing in mind the overall context where many of these the institutional infrastructure itself was still being built by the time the pandemic hit. But the pandemic was quite revealing when it comes to the extent of informal employment all over the world, by the way, not only in the global south, but also in the global north, in a way that I think requires significant, cross-country examination in the future, because you simply have precariousness being an understatement when it comes to how a significant percentage of people in the labor market, the conditions under which they are related to their employers. So this is something that apparently results from a very weak regulation to start with, and itself leads to the perpetuation of weaker regulation. So the state does not have the kind of information that is needed to address the questions of emergency. And apparently this is something, again, that cuts across. You can think not only of Egypt, you can think of India, Brazil, and I would say even the United States, which is quite interesting that you have this showing. And most probably this is something that we try to bring up like throughout the papers, not Dina and I mean like the people that worked within the project, we had a very big team. They tried to bring up the long-term impact that neoliberalism had on the deregulation of labor markets, contributed to the expansion of precariousness and informality, which is something that we already know, but something that also questions the ability of states and state agencies to act in times of emergency, like the pandemic. And this like raises many questions about how, like the not only the pandemics to come, but other emergencies and other like not business as usual things that might happen in the future.
Yeah, I think we were just basically pretty unprepared for it, and the resources that existed, يعني some of it was you know, was widened. So مثلا the access to تكافل وكرامة was made bigger. The shelters that were supposedly in use for women who undergo domestic violence were supposedly made to function more. They created a hotline for women to talk about domestic violence. And I'm thinking here, and when we think of informal labor, is this one of the conceptual things that we were thinking about, is to think of women as part of these informal labors. It's not just those men who are working, you know, in different precarious jobs, but also doing domestic labor at home as a form of informality in a way. So to talk about also access, what happened to in terms of support there. Yes, there were the 9 or 11 shelters that exist in Egypt, but as we see and as the papers show, unfortunately, the kinds of interventions that were there depended on what already existed before, and what already existed before was very lacking in a way. Incomplete. The shelter is not very safe. People don't know about them. They're not even very. They weren't also equipped for Corona times, and so on. We know that maybe a bit more people benefit from تكافل وكرامة, but that's not really, a broader way of thinking of social protection, which is why one of those papers that we have talks about how in our macroeconomic thinking, social protection often comes as an afterthought and not as part and parcel of how we think of balances and how we think of financial planning and so on in terms of government. And that it was very important for us to also frame it in that perspective. So it's not just about which project was successful or which intervention, but also what is the overarching way in which we look at social protection. Is social protection something that comes at the end of our macroeconomic thinking, or how can we make it much more ingrained in there?
Thank you, Amr and Dina, and thank you to our viewers. This was the end of the first of 2 episodes on the Social Protection Egypt project at the American University in Cairo. For the second part of this interview, please join us on our next episode.